is an essential part of the solution, but not the only part, and not an immediate solution. We cannot put all our eggs in one basket. We have many vaccines for many diseases, but for each of them, we still need a combination of vaccines and public health measures. The same is true with COVID-19. Vaccines prevent disease, but we can also prevent infection with public health tools that have been so effective in so many places. My message to leaders is, use every tool at your disposal to drive transmission down right now. Even if your country has a downward trend, now is the time to surge your capacities. Even in countries with the highest vaccination rates, public health capacities must be strengthened to prepare for the possibility of vaccine-evading variants and for future emergencies. My message to individuals is, every contact you have with someone outside your household is a risk. The level of risk varies according to the type of contact, the duration of contact, and the level of transmission where you live. Each contact might carry a small risk on its own, but the more contacts, the higher the risk. In many Northern Hemisphere countries where the weather is warmer, people are getting together for social gatherings. In the Southern Hemisphere, colder temperatures are driving people inside. Both situations carry different types of risk. But when you know your risk, you can lower your risk. There will come a time when we can all take off our masks, when we no longer have to keep our distance from each other, when we can once again go safely to concerts, sporting events, rallies, and restaurants, as people in some countries are able to do now because they have no transmission. But for most of the world's population who are not yet vaccinated, we're not there yet. To get there, we continue to urge all countries to develop and implement comprehensive and cohesive national plans based on the 10 pillars of WHO Strategic Preparedness and Response Plan. How quickly we end the pandemic and how my sisters and brothers we lose along on the way depends on how quickly and how fairly we vaccinate a significant proportion of the global population, and how consistently we all follow proven public health measures. Christian, back to you.
Thank you very much, Dr. Tedros. With this, we'll open the floor to questions from the media. As said before, please raise your hand with the raise your hand icon, and we'll start with Suyata Bhattacharya from the Wall Street Journal. Suyata, please unmute yourself. Suyatapa, do you hear us? If so, please unmute yourself. We seem to have trouble with Suyatapa. We'll come back to you in a moment when we have figured this out. And let's start with Christoph Vogt from the AFP. Christoph, please unmute yourself.
Hello, good evening. Thank you for taking my question. This one was on Sinopharm. Who provided emergency use listing last Friday on the Sinopharm vaccine. But at the same time, we saw some worrying reports from the Seychelles where this vaccine was used quite a bit. And still, the pandemic doesn't seem to abate and the numbers are going back up. Can you tell us what's happening there? Is it due to the vaccine? Is it several different factors? Thank you.
Thank you very much. Mariangela Simao, please.
Thank you, Christoph. Let me start, and then colleagues can talk about the Seychelles situation specifically. The Sinopharm has received an emergency use listing by WHO on Friday after an extensive review by an external technical advisory group that looked at different data. We did site inspections in China in January and February, and so the good manufacturing practices, the Sinopharm is compliant, and we also assessed the clinical data that's available for Sinopharm, and it was also considered suitable on efficacy and safety and good manufacturing practices. The specific situation of Seychelles, we know that the vaccines we have right now in the market, they don't. We still have data proving that they are efficacious against severe disease, right? So there's less data about transmissibility. So I don't know the specific situation of Seychelles, but Sinopharm has been very much used globally. I think it's 62 million doses have already been applied, and it has been considered both safe and efficacious. So I don't know if anyone wants to comment on. I can.
We're calling out for Kate O'Brien, Dr. Kate O'Brien, the Director of Immunization, Vaccine and Biologicals, who should be online. Kate?
Thank you so much. Yes, this situation in Seychelles, we're in direct communication with the ministry about this. It is a more complicated situation than sort of the top line messages. As was noted, the vaccines are highly efficacious against severe cases and deaths. There are most of the cases which have occurred are mild cases. However, what is also important is that a substantial fraction, over 80% of the population, has been vaccinated. But as we know, the vaccines after a single dose, the Sinopharm vaccine really requires 2 doses. And some of the cases that are being reported are occurring either soon after a single dose or soon after a second dose or between the first and second doses. So in general, I think when we see cases continuing to occur in the setting of vaccine, it really does require a very detailed assessment of what the situation is. First of all, what the strains are that are circulating in the country. Secondly, when the cases occur relative to when somebody received doses. Third, what the severity of the cases are. And only by doing that kind of evaluation can we make an assessment of whether or not these are vaccine failures or whether it is more about the kinds of cases that are occurring, the milder end of cases, and then the timing of the cases relative to when individuals received doses. That evaluation is ongoing, and we're supporting and engaging with the country to understand the situation.
Thank you very much, Dr. Kate O'Brien. We'll now try again with Suryatapa Bhattacharya from the Wall Street Journal. Suryatapa, please unmute yourself.
Hello, can you hear me?
Very well, go ahead.
Thank you. My question is about the India variant and whether you are considering classifying it as a variant of concern and why.
Thank you very much. Dr. Maria van Kerkhoff, please.
So thanks very much for the question. I assume you're talking about the B1617 virus variant that was first identified in India. Indeed, this is one that has been classified as a variant of interest by WHO. Over the weekend and last week and into today, our EPI team and our lab team has been discussing with our virus evolution working group this variant, this B1617, and everything that we know about it in terms of transmissibility and any studies that are being done in India as well as in other countries where this virus variant is circulating. It is important to note that this lineage, this B1617, has 3 sublineages, the 0.1, 0.2, 0.3. I won't go into that level of detail. All of that will be provided in our SITREP tomorrow, where we will outline all of the information that we know about each of those sublineages. Having said that, in consultation with our virus evolution working group and our EPI teams and our lab teams internally, there is some available information to suggest increased transmissibility of B1617. There is a preprint that is out. So this is a paper that has not undergone peer review, and it's of a limited number of patients, suggesting that there is some reduced neutralization, and as such, we are classifying this as a variant of concern at the global level. There will be much more detail provided in our SITREP tomorrow around all of the available information that we have. What we do want to say is that even though there is increased transmissibility demonstrated by some preliminary studies, we need much more information about this virus variant in this lineage, in all of the sublineages. So we need more sequencing, targeted sequencing to be done and to be shared in India and elsewhere so that we know how much of this virus is circulating. We need more information on the epidemiologic studies that are underway, the studies that are evaluating neutralization, severity. So far, from the information that we have, the public health and social measures work, but we need to work that much harder to control any virus variants that have demonstrated increased transmissibility. We don't have data yet on diagnostics, therapeutics, and vaccines. But we don't have anything to suggest that our diagnostics, our therapeutics, and our vaccines don't work. This is important. We will continue to see variants emerge. We will continue to see variants of concern around the world, and we must do everything that we can to really limit the spread, limit infections, prevent the spread, and reduce severe disease and death with the tools that we have at hand. So much more work is being done around the world with our partners. We do have this global risk monitoring and assessment framework for variants, and this is exactly why we have established something at the global level, which covers everything from surveillance to detect mutations and variants through a proper and robust assessment for each of these mutations and each of these variants of interest, as well as variants of concern. What this means for everybody at home is that any of the SARS-CoV-2 viruses that are circulating can infect you and can spread. And so everything in that sense is of concern. So all of us at home, no matter where we live, no matter what viruses are circulating, we need to make sure that we take all of the measures at hand to prevent ourselves from getting sick. It's the individual level measures, physical distancing, hand hygiene, wearing of a mask, avoiding crowded spaces, improving ventilation, spending more time outdoors as opposed to indoors if you can, work from home, all of the measures that are at hand, and ensuring that governments provide a supportive and an enabling environment so that we can carry out those measures that keep us safe. So more information on this variant of concern, the B1617, will be issued tomorrow in our SITREP, and we'll make sure that the link is made available. It's available on our website, and you should read that SITREP every week if you can. And we are very grateful for colleagues in India, as well as around the world with our Virus Evolution Working Group and elsewhere, who will continue to carry out the studies to help us properly assess what the impact of this variant of concern is. But so far, our public health and social measures work. We need to continue to do it all to limit the spread.
Thank you very much, Dr. von Kerkhove, and now Dr. Soumya Swaminathan, Chief Scientist.
Maybe just to add very briefly to what Maria said, sequencing is telling us a lot more about this virus in real time than we've known in previous outbreaks. In fact, for many diseases, we really don't have this kind of genomic information that we have. So it's a good thing because we can keep up with the evolution of the virus, but we also need to take a balanced approach. And as Maria said, whatever the variant, the basic modes of transmission and the clinical illness remain the same, and the public health measures remain the same. We do know that the Indian government has a consortium for genomic surveillance, and that there are a number of investigations going on now on the B1617 variant that's looking at both the transmissibility, the clinical severity, and also the response to the virus to antibodies that have been generated in people who've been vaccinated with the different vaccines that have been used in India, especially the Covaxin and the Covishield, and also the Sputnik vaccine. And so over the coming weeks, there'll be much more data forthcoming. But variant just on the genomics alone doesn't mean anything. It only tells us the story when we know the complete information, both on the clinical profile, on how it's spreading, the transmission, as well as on how it's behaving in the community in vaccinated and unvaccinated population. So it's really important to undertake those studies and to give enough time for that data to come in. But again, just to emphasize that as what we know now is that the vaccines work, the diagnostics work, the same treatments that are used for the regular virus work. So there's really no need to change any of those. And in fact, people should go ahead and get whatever vaccine is available to them and that they're eligible for. Thank you.
Thank you very much, Dr. Swaminathan. Next question goes to Michael Bochokiev from CNN Opinion. Michael, please unmute yourself.
Thank you for taking my question. It's been a while. Good to be back. My question is the following. Vaccine diplomacy has become part of our COVID-19 lexicon. However, it seems that many of the countries are engaging in the diplomacy not simply for altruistic reasons. What I mean by that is many recipient countries are being strong-armed to guarantee market access or adhere to an unwritten set of diplomatic rules. I was wondering if you might advocate a kind of set a code of behavior rather for countries engaging in vaccine diplomacy, because I think a lot of countries that are poor, and Dr. Tedros mentioned the poorer countries are not getting enough vaccines, but a lot of them, I think, are getting into situations which they might regret later on. And just quickly, the numbers are quite startling. China is donating free vaccines to 69 countries, commercial order to 28 others, Russia, Sputnik vaccine to 70 countries. And finally, as we know, India is also exporting, and with them and China and Russia, all three countries, their domestic vaccination rates are very low. So can some kind of better code of conduct be advocated here? Thank you.
Thank you very much, Michael, for this. Let me look around. Maybe start with Dr. Bruce Aylward. Thank you very much.
Thank you, Christian, and Michael. Thank you very much for the comment. We're not in a position to comment on any of the conditionalities that have surrounded the donations of vaccines to one country or another. We actually don't have a good sense of those. In terms of a code of behavior, Michael, what the COVAX facility, the whole concept of COVAX, is the code of behavior that we've been urging that should underpin the global rollout of vaccines. And that is that we have a common approach, a common framework, a common rollout of these products to make sure that they go to the countries and populations that need them most, based on the principle of equity that we've been talking about all along. And the goal, of course, is a rollout first to make sure we protect our healthcare workers, make sure we protect our older populations, most at risk of dying from the disease. And it was recognized over a year ago when we started to try and develop vaccines, that as we did so, they would be an incredibly scarce supply from the outset. So the establishment of COVAX and the allocation mechanisms that underpin it were putting in place a global code of behavior, in effect, that would try to address some of the challenges that you referred to. And in that code of behavior, what we are promoting is global cooperation through a common process with complete transparency on who's getting which vaccines in what order, and then with as many possible doses as possible through the COVAX facility, so that we can ensure the equitable rollout, that populations, countries that may not have the relationships, geopolitical or otherwise, that would make them favored candidates for donations. Countries should not have to rely on the favor of others to be able to access vaccines in a crisis like this. So the code of behavior is very much anchored in the principles that underpin the COVAX facility.
Thank you very much. That was Dr. Bruce Aylward, the Special Advisor to DG and the lead on ACT Accelerate, and Mariangela Simão, please.
Thank you, Michael. Let me add to what Bruce was saying in terms of the COVAX facility being an equitable access mechanism that we are very much working on and striving to get enough doses to be distributed. I would say we also need a change in the it's not necessarily the code of behavior, but I think we are seeing also, we're living in a world where many of the producers are moving towards a profit-driven approach instead of an equitable access approach. So WHO is pushing very hard at the highest level for everyone who's manufacturing vaccines to consider seriously putting these vaccines in a global mechanism that will ensure that all countries have access to them, not only high-income countries who can pay more for the vaccines, as we're seeing as we speak right now. So I think that the code of behavior, when we're talking about it, is not only for vaccine nationalism, it's for everyone who has a product that can be a public health good and can help us end this acute phase of this pandemic. Thank you.
And the Director General, please.
Yeah, thank you. I mean, just wanted to say a few words. In international relations, there are three ways of engagement, as you know. One is cooperation, the second is competition, and the third is confrontation or conflict. You can choose from the three C's. To end this pandemic, the only choice we have is cooperation. Vaccine diplomacy is not cooperation. It's actually a geopolitical maneuvering. So it's the clear and clean cooperation that can help us to end this pandemic. I don't think this is really something that many don't understand. Everybody understands it. But from WHO side, we have been saying, we cannot defeat this pandemic through competition. We can't. If you compete for resources, or if you compete for geopolitical advantages, then the virus gets advantage. And if there is confrontation, that even is the worst. And we have seen it, by the way. There was confrontation that undermined the whole response, especially last year. So the choice is clear. Cooperation, and global solidarity. And that needs actually a very basic principle of identifying the virus as a common enemy. So there is clarity on who the enemy is and how it has to be tackled. It's a virus, a common enemy, that can only be tackled through cooperation. So that's what we are saying repeatedly. And what you said, thank you so much for this very important question. It's undermining or delaying the end of this pandemic. Again, we repeat, the only option is cooperation. No competition, no confrontation or conflict. Confrontation, competition, and confrontation helps the virus. Competition and confrontation or conflict divides us and again helps the virus. So our choice should be cooperation. Thank you.
Thank you very much. We'll continue with Shoko Koyama from NHK. Shoko, please unmute yourself.
Hello, Christian, can you hear me?
Very well.
Thank you for taking my question. The spokesperson of Taiwan said today that today was the deadline for the online registration for this year's World Health Assembly, and they haven't yet received an invitation. May I ask if the deadline of the online registration was today? And may I also ask WHO's position for inviting Taiwan for the 74th World Health Assembly? Thank you.
Thank you very much, Shoko. I believe we have Steve Solomon, the Principal Legal Officer online. Stevens.
Thank you. Thank you very much for the question. The deadline was, in fact, today. The question of Taiwan's participation at the World Health Assembly is a question for member states. The issue of the participation of Taiwanese experts with the Secretariat on our work responding to the COVID pandemic is a matter that the WHO Secretariat has engaged in very robustly. Let me give you 5 examples of where we work very closely with Taiwanese experts. The Taiwanese have a point of contact for the international health regulations. They participate in key networks for responding to COVID. They participate in the COVAX facility. They work with our experts through the European Centers for Disease Control, and we work face-to-face through virtual meetings with Taiwanese experts and have done so regularly for months. Those are meetings between Dr. Van Kerkhove, who's present, and Dr. Oliver Morgan, and their experts in Taipei. So at a technical level, there is more and more robust cooperation on COVID. This is also the case on other public health issues where Taiwanese experts have participated in, have been invited to 5 meetings just this year on a range of public health matters. Taiwanese experts and authorities are participating with WHO in areas involving influenza and in the fight against cancer as well. So participation at the expert level, which is something the Secretariat is absolutely committed to with all people everywhere and with all experts everywhere, is very robust. When it comes to participation at the World Health Assembly, invitation to the World Health Assembly, that is something that is in the hands of the member states, the countries that constitute the assembly. And that is a decision that they are empowered to make. It is not a decision where the Secretariat has the power to act when there is has been clear when the Health Assembly has addressed itself to this point, as they have repeatedly over many years. So I'll stop there, and I hope that clarifies how we participate at the technical level and the question of participation at the Health Assembly. Thank you very much.
This was Stephen Solomon, the Principal Legal Officer for WHO. Thank you very much. Next question goes to Emma Farge from Reuters. Emma, please unmute yourself.
Good afternoon. Question for Dr. Tedros, if I may, please. I bet in 2017, when you were campaigning to be Director General, that you never thought you'd be steering the world through the worst pandemic since the Spanish flu. Do you have the appetite to keep going as Director General? Will you seek another term? Do you think you can count on the support of your government and Africa if you do? And may I sneak in a quick one about Congo? Is there any update at all on the probe into sexual exploitation there, which was launched 6 months ago? Thank you very much.
Let me start with the Director General.
Yeah, thank you. Yeah, thank you so much. I will start from the second one. As you know, there was an allegation of sexual exploitation and abuse. We have decided, actually, as soon as we got the information, we have decided to do it differently. Normally, we could have sent an investigation team to investigate, propose, and so on. But we wanted to do it in a different way, and this time we appointed or established an independent commission. In addition to that, the independent commission, after we selected the co-chairs, actually, the co-chair selected the panel, the rest of the panel, plus the commission hired an external investigation firm to do the job. So this would help us to get an independent assessment and also recommendations that can help to address the perpetrators, but at the same time recommendations to help address if there are systemic problems. So this is the first time we're doing it. We're moving into uncharted waters actually, but we believe that it's very important to do it differently, and instead of doing things the same way again and again and expect a different result. And that may also help us to strengthen our own internal investigation capacity too. Then coming to my specific question, as you said, not only COVID, I started with Ebola in Western DRC, Equator province. That's in May 2018. And that was actually stopped, or the pandemic, the outbreak of Ebola in the Equator province was over in 3 months. And then another one started in September 2018 in DRC, again, but in Eastern DRC, in a more difficult place, as you may know, North Kivu, which has security challenges. More than 17 armed groups actually operate in that area. And not only Ebola challenge, but there was a security challenge. I have been to that place more than 11 times. And my colleagues and other partners, we did all our best to end it, but it took us almost 2 years actually to stop it, a very challenging one. Then, of course, COVID, and we're still working on it. So I think it's time to still focus on this pandemic. It's very unprecedented. So I'm currently focused in fighting this pandemic with my colleagues and working day and night. Thank you.
Thank you very much, Director General. Next question goes to Gabriela Sotomayor from Progreso. Gabriela, please unmute yourself.
Thank you, Ola. So a few days ago, more than 10,000 people attended a rock concert in Wuhan, in China. People sang, they danced. Most of them did not have a mask on. So we know that at the beginning of the pandemic, they were very strict, but how have they managed it? What other steps have they taken? Have all the people of the city have been vaccinated? What do you know about Wuhan right now? Thank you.
Maria may supplement, but I think Wuhan and most of China are enjoying the benefits of having controlled the virus effectively. No, the vaccination rates in Wuhan are probably no higher than anywhere else in China, and certainly vaccination doesn't account for the situation they currently experience. Wuhan in particular suffered hugely in the first part of this pandemic, made huge sacrifices, brought the disease under control, and importantly has kept the disease under control. And it's not unusual in situations of very low incidence for people to be meeting outside without masks. You're seeing the same in Australia, you're seeing the same in New Zealand, you're seeing the same in many countries who took a comprehensive approach which focused on continued reduction of exposure while dealing with all the other issues. And in that ability to reduce exposure to a level where the incidence of disease dropped to very, very low levels allows countries, cities, areas with that degree of control over the virus have more choices about social life, about economic life. And I think those choices are now being exerted. Now, having said that, I do believe in China and other countries who have very low incidence remain exceptionally vigilant, constantly on the lookout for that single case, that cluster, and they react extremely quickly when they see those clusters in order to maintain that level of control. So they're in a phase of control in Wuhan in China and in other countries where they have extremely low incidence with a degree of risk for reintroduction, for which they maintain heightened alert, but in the meantime, allowing people to go about their normal daily lives. I think that's a situation many countries would like to be in right now, with or without vaccines. Priya?
Not much to add, because I think you've covered it. But I think what we see in Wuhan and what we see in other parts around the world are a demonstration of how this comprehensive approach works in controlling COVID, even without the vaccine. So adding a vaccine just makes it that much more, our control measures that much more powerful. Not only did we see Wuhan and other parts of the world, really use this comprehensive approach of public health, identifying cases, providing care for those who are infected in isolation facilities, whether they were in hospitals for those who were severe and had underlying conditions, so at risk for developing severe disease, as well as isolating those who had mild disease or who were asymptomatic outside of the home in special facilities that were built. They had contact tracing systems in place to be able to provide supported quarantine for those who were contacts of individuals who were infected with SARS-CoV-2 virus. And they followed through. I think that's the other thing. It's not just the application of a strong, comprehensive plan. It's following it through all the way through, driving transmission down, but keeping it at a really low level. And as Mike said, remaining at the ready, being extremely vigilant, remaining at the ready. So any additional cases that pop up are dealt with very quickly in a supported way, and so that any clusters do not become bigger. If you remember, the way that we've talked about cases through all of our guidance materials is through these Cs. We call them the 4 Cs. There's now 7, where we have no cases, we have sporadic cases, clustering of cases, community transmission. And community transmission has 4 categories depending on the level of intensity of spread. Now, once you get into intense transmission and community transmission, it becomes very, very hard to bring it back down to lower levels of intensity. But China and many other countries, for that matter, showed us that it was possible by applying this comprehensive approach. All of these elements that are outlined in WHO's strategic preparedness and response plan that the Director General mentioned again today, all of these elements, these pillars of activity, need attention, need nurturing, need application to continue to drive transmission down. Even in countries, our other messages, as you heard the Director General say today, even in countries that have controlled COVID, it is really important to remain vigilant. It's really important to remain at the ready because we remain at risk, because the virus is circulating in other parts of the world, in many parts of the world. With at least 5.4 million cases reported last week, this virus still has much room to spread if we allow it to. So there's a lot that we can do. China and other countries have shown us that with a comprehensive approach, seen all the way through, can really keep it down. And what you see with the opening up of concerts, the opening up of social activities, that is the result of really dedication from many around the world. And so we advise to continue to remain vigilant and to drive transmission down, prevent infections. Among those who are infected, prevent the spread, and among those infected, make sure that we prevent them from developing severe disease and death. So public health and social measures and vaccines and vaccinations are really the recipe, but we need all of those ingredients within that recipe, not just one.
Thank you very much. We have time for one last question, and that goes to Ashwin Barshinger from the Observer Times India. Ashwin, please unmute yourself.
Thank you for considering my question. As till date, WHO bringing together government and private sector and academia. My question is WHO scientists and scientists around the globe.
Ashwini, we lost you there right now. The sound dropped.
Identified virus host dynamic, which.
Ashwini, very sorry, the sound dropped twice now. Try one more time, please. Last call for Ashwin. The sound dropped, unfortunately. Try one more time to unmute yourself.
My question is WHO scientists and scientists around the globe identified virus host dynamic, which is important in development of safe and efficacious vaccine, is virus host dynamic varies in SARS-CoV-2 variants?
Not sure what the question is, Ashwin. I'm sorry. We're trying to...
Hello?
Yeah,
Can I repeat?
Yeah, I think maybe I didn't quite get the question, Christian, if you
Exactly.
could clarify that.
So, no, Ashwin, what we'll do is please try send in writing, and if we don't get to it now anymore, which we won't, then we'll answer in writing, because we don't want to interpret here or guess what you're asking. It's not worth it. So please get us to us in writing, and we'll answer to you in writing.